Hi, everyone. Welcome back to the Lights Too Bright podcast. Thank you for joining me again, hopefully again. If you aren't already, please, I'd like if you could like, follow, and share. Get up my numbers on the YouTube. That would be really helpful. Today's guest is a friend, a colleague, as always, who I was fortunate enough to meet at a contact lens event. So he has a passion for contact lenses, as do I. And through this, it was a scleral lens event, if I remember correctly. Through this scleral lens event, which we had at our practice, we got to meet and talk and become friends. And he's got a really interesting journey because his journey didn't start in the UK. So I'm going to let him share it because he tells it much better than I do. And I would like to introduce Mr. Trey Trott. Evening, sir.
Yes, good evening, good morning, good afternoon to wherever you guys are. It's one of those, right? So my name is Trae. I am an optometrist, as you could imagine here. Born and raised in Bermuda, right? Born and raised in Bermuda. That's where I did most of my early childhood education, as you could imagine. And then from there, I went off to Canada. From Bermuda, I went off to Canada. The reason being is because
high school in Canada, Trey?
No, so this is university. This is university. Okay. So high school in Bermuda. High school in Bermuda. When I turned 18, that's when I shipped off to Canada to start an undergrad in biology. And it was interesting because leading up to that, I wasn't 100% sold on optometry at that point, right? I wasn't 100% sold on optometry. Coming out of high school, it was optometry, and then it was also the option of marine biology, right? Being from Bermuda, as you could imagine, being surrounded by water.
But very different. Right? It's not like optometry or dentistry or optometry or medicine, optometry or marine biology. Okay.
Yes, 100%. So optometry, marine biology. Marine biology, like I said, you could assume being surrounded by water, being surrounded by that marine life, growing up in it. I grew to love it, right? When I was much younger, my parents used to put me in a summer camp called Aqua Camp, and it was at the local aquarium and zoo. So I grew up loving and learning about the ocean, right? About the marine life. So that was always something there, right? It was always in the background. Optometry now came in, I don't want to say out of left field, but growing up, okay, so a bit of my own personal case history, right? Growing up, I had both of my lenses, right, my natural lenses, dislocate, right? I had both my natural lenses dislocate. And so I spent quite some time backwards and forwards from Bermuda and New England, so in the States, right? New England, trying to figure out why with pediatric ophthalmologists, optometrists, and all sorts, trying to figure out why my lenses were dislocated, right?
So was years of Mass Pioneer or Harvard or
no, it was at Tufts. Yeah, it was at Tufts, right? It was at Tufts, and we couldn't come up with a diagnosis, right? Blood tests. Obviously, you got Marfan syndrome. That's the most common one. It tends to be the culprit, but again, no one could come up with why, right? All of those tests were inconclusive and or negative. So it was one of those things that just happened, right? It just happened. And so when I was 12, I got the lens removed in my right eye. And they didn't opt to put one in because I was still young, I was still growing, I was still developing. The eye was still growing. And so they said, we take it out, but we would wait to put one back in. Okay. This was at 12 years old. And then when I was 18, that's when I had got the left eye removed. And they still didn't opt to put any in. So at that point, it was contact lenses for me. Because I wasn't, walking around with Coke bottles, right? That wasn't happening.
Yeah.
Right. So contact lenses. Without the lenses, as you can imagine, I wasn't seeing much. But that was what started, I think, my interest and sparked the interest into the world of optometry and the world of optics.
Okay.
Right.
So no one in the family, medics or optometrists or anything like that?
No. So my mother's a school teacher and my father is an accountant, right? And that's, as I would argue, as professional as it gets in my family. So nobody in the healthcare profession, right? But growing up in and out of the hospitals, in and out of the consulting rooms, I said, I've learned so much about my own eyes as a patient. Why not continue on that journey? Right? Why not continue on that journey? And so when it came time to decide what I want to do for university, right, it was, again, marine biology was still lingering, but then I said, hey, optometry is there, right? And having that conversation with my parents, with my father, as you can imagine, an accountant, he's like, okay, well, which one's going to get, the greatest return on investment, right? And so he said, Trae, Bermuda's an expensive place, right? Bermuda's an expensive place. Yes, it's all great doing what you love, but you want to make sure it's also going to bring in that income, right? That could support whatever lifestyle you and your future family would want to have, right? So going into my undergrad, I did biology, right? The plan was to pursue optometry in the States, just because Bermuda is so much closer to the States. And growing up, I was accustomed to the U.S. model of optometry, right? Because it's very similar in Bermuda. And so that's what I thought was going to happen, right? That's exactly what I thought was going to happen. I was going to go do an undergrad, rather be in the States. In Canada, I chose Canada because it was a bit more affordable at that time.
Okay.
It was a bit more affordable to do an undergrad. But then when it came time for optometry school, it was just way too much money as an international student, right? Keeping in mind, as an international student. And it just, at that point, wasn't feasible to pursue optometry in the States at that particular time. Who knows what would have happened if I would have waited a few years or what have you, right? But at that point in time, it wasn't feasible.
Yeah.
And so, you was going to say something?
No, I was going to say, yeah. I mean, having done it, I know how expensive it is to do an international program in the US. The problem, and one of my friends who had colleagues who I had on earlier was saying that actually, the problem with Canada is it only has 2 schools. And in one of them, you have to speak French. So the other school is outrageously difficult to get into because the people getting into that school are like absolute creme kind of stuff. So you can be smart, but these guys are next level. So that's why we get a lot of Canadians in the US. But I was there for 2 years in school and I racked up north of $100,000 worth of debt in 2 years. And that was before living. And I was lucky enough to be living with my brother, so I didn't even have to worry about that. So
that's
4
exactly
years plus living, you're looking at $250,000.
100%.
Just to get through optometry degree.
So I was looking to do this in 2015, 2016-ish, right around that time. So quite a long after you had gone through that process. But at that time, just looking around at some schools in the New England area, Massachusetts, East Coast of the States, we were looking at 70 to 80 plus just for tuition, right? 80 grand a year just for tuition, right? I hadn't eaten. I don't have a place to stay. I haven't bought textbooks yet. Not just tuition, right? And at that point, it was like, okay, well, there's got to be another way, right? There's got to be another way. And so that's how I ended up in the UK, essentially. As a Bermudian, we are also British or I guess UK citizens, right? So we have dual citizenship. We have Bermudian passport and we have our UK passport. So it was a lot easier for me to come, even if that flight was 7 hours rather than an hour and a half. It was a whole lot easier for me to come to the UK and still pursue optometry. And so that's how I ended up here, essentially.
So I'm just curious, actually. So as a Bermudian with a twin passport, do you then get you don't pay international student rates, or do you still have to pay international student rates?
So what a lot of Bermudians do, right? What a lot of Bermudians do, knowing ahead of time, hey, I think, I'm gonna capitalize on this dual citizenship, and jump over to the UK. They would finish off their high school right here in the UK and then go straight off into university. So that's typically what happens. But yeah, I don't need any visa or any additional documentation to come over and study. So it was a pretty seamless transition for me, right? Which is also what made it.
And for the audience, because I know this, we've had this discussion.
Yeah.
So in Bermuda, you can practice as a British optometrist or as a US optometrist, as long as you have an optometry qualification, recognized optometry qualification.
Yes, 100%. So because Bermuda is so right. So for those of you guys who don't know, Bermuda, really small island. We have roughly 60 to 65,000 people. It fluctuates, over the years, but usually it's averaged around 60,000 individuals on the island. Now, that population isn't big enough to have a full-on university, okay? We have a college where you can get an associate's degree, do it 2 years, and then transfer to a university in the States or transfer to a university in Canada or in the UK, but we don't have a university on the island. And so in order, right, to have professionals on the island, you have to accept degrees and qualifications from all over the world, right? Because it just wouldn't happen otherwise. So we have in Bermuda, right, since the beginning of time, I guess, we've had UK trained optometrists as well as US trained optometrists. As long as you can prove and show, yes, you have an optometry degree, and you belong to a governing body, right? Rather it be the GOC or whatever it is in Canada or whatever it is in the States, right? If you show that evidence, and then if you keep up with your CPD points and all sorts, right? In accordance with that governing body, wherever you receive that, the qualification, then you're free to practice, right? You're free to practice.
So, okay.
So, yeah. So on the island, I will say, right, it is the American system, is the American way with insurance and such, rather than the NHS. Majority, at one point in time, all, if not all, the optometrists were US trained optometrists on the island, but you do get a few locums that will come and go. Right, you do get a few locums that will come and go. I know I have a friend, she's an optometrist. She moved to Bermuda to locum at this one clinic for 3 months, right? 12 years later, she's still there, right? From London, right? You have a few from Ireland. So you do get those locums that end up coming, hey, I can work whilst I'm on vacation and end up staying there for 12 years.
Yeah.
Right. So that's the optometry scene in Bermuda.
Fantastic. So where did you do your optometry degree in the UK, Trae?
Yeah. So I was up in Bradford. And before that, that trip to the UK, I had never been here before, right? I had never been to the UK.
He went
And I
from Bermuda
figured,
to Bradford.
yeah, exactly, right? I figured, hey, the UK is the UK, right? One place, is just as good as any other, right? I mean, I think I'm gonna leave it at that with regards to with regards to
I think for someone who's grown up surrounded by the sea,
yeah,
to end up in Bradford,
yeah,
well, I don't think there's any sea anywhere near
none
Bradford.
whatsoever,
And also the weather to be up north.
Yeah,
You must have been
yeah.
like, what have I done?
Yeah,
How
well,
have you ended up here?
You know what? I think temperature wise, I was okay. Because keeping in mind, I had just come from -20 to
Canada.
-40 degrees in Canada, right? I had just come from Canada straight over. So temperature wise, it was okay. What I didn't appreciate was just how gray and wet it was, right? You hear the stereotypes. Right? You think, it's just an exaggeration. No, but you come, and that was my reality, right? That was my reality.
It's fine, but I mean, you do it, you get through it. You're motivated. You go, right, fine. It's 3 years. 3 years flies because you actually end up having fun wherever you are. I think if you make an effort to integrate with your class, and classes above you, below you, it's always fun. And before you know it, you're like, how are we leaving? I've only just got here. Why? Where am I doing? So.
100%.
I mean, I had the same idea when I went to check out Aston, when I was looking to decide where to go, and I was like, oh God, Birmingham. And then I looked at Aston and I was like, I can't live here. This is just too grey. And then ended up in London, and I loved it. But I had so many friends who went to Aston and they go, it was amazing. I've so many colleagues who have been through Bradford and gone, it's such a great program.
100%. Yes. Yeah.
And really enjoyed it. Really enjoyed being there.
Yeah. The program, I couldn't fault it at all. Right. The program itself, the optometry program, I couldn't fault it at all. And I think I used it with part of the advice and guidance from my parents, more specifically my father. Use it as a means to network, right? Use it as a means to get to know people, to learn, okay? Because, hey, one day I may end up back in Bermuda, right? Rather I'm starting a practice or working for someone or whatever the case may be, but hey, we may need a locum, right? Who were some of my mates in school, right? Who perhaps were some of my supervisors or professors that, you know what, I can do for change in scenery.
Yeah.
Right?
And it's great. That's how opportunity arises. You sort of do have to make an effort.
Yeah.
So after Bradford, where did you end up? Did you end up on the South Coast straight after Bradford, or where did you pre-reg? What did you do then?
Yeah, so after Bradford, and keeping in mind this was just after COVID, right? Just after COVID, tail end of COVID. So okay, so part of my degree, the early part of it was during COVID, right? So coming out of COVID, now it's time to apply for pre-reg. Where do I go? Right. And again, I'm not from her. I didn't have, I don't want to venture too far from my parents, or I don't want to venture too far from my family, or, this is where I grew up. I want to stay in there. Like, I didn't have any of that. I could have been anywhere, right? I had opportunity in Guernsey. I had opportunity down south. It's ended up where I am now in along the South Coast, right? But I went from Bradford to Weymouth.
Nice.
So right by the beach. And I remember vividly, right? I remember stepping off the train with my suitcases, and you can just smell the sea breeze. You can just smell the salt water. And it was something that I didn't realize I was missing. You don't realize what's not there until you realize this smell is familiar. This feeling is familiar, and I loved it. Right? I think it was perhaps the best thing that I could have done, coming back down to be along the coast. I think was the best thing I could have done.
Nice. That's
Sanity.
amazing. That's amazing. Yeah. And there's peace in
Mm-hmm.
things that you understand. There's peace in things that you know and can relate to. And even if that's just as simple as smelling the sea,
Mm-hmm.
because, what you've done is, for a lot of people, as you've mentioned, won't do that. They will look to be close to home or not venture far from maybe where they've done their degree because they've got, I like it here. And then they don't want to move away from that. And in doing that, sometimes you almost miss out on other
100%.
aspects of things,
Yeah.
because
Yeah.
you don't know what it's like to live
Yeah.
abroad. You've done it. You've lived
Exactly.
in 3
Yeah.
countries.
Yeah. Yeah.
I've been fortunate enough to live abroad,
Yeah.
and it really helps you grow. And that
Mm-hmm.
idea of networking and
Yeah.
professional development,
Yeah.
you get a lot of that, which is
Yeah.
amazing. So what do you do
100%.
now then? I mean, you've done your pre-reg. Did you stay with
Yes.
that company? Yeah.
Yeah. So finished my pre-reg. I was there for, I want to say a year, maybe a year, maybe just under a year. Time flew by, as you can imagine. But from Weymouth, I then moved to Bournemouth. So I got married at the time, and my wife is a CBT therapist, but she was based in Southampton. And so we had Weymouth and Southampton. We said, okay, well, let's smack in the middle so that I can still venture to Weymouth and she venture to Southampton in the mornings. And then from there, from Weymouth, I said, okay, well, let's get somewhere a bit closer, right? Let's specifically find somewhere that is a bit more clinical, for lack of a better term, right? Where I was high street practice, and it was more or less just refracting. Okay, patients coming in for glasses, and that's all they want, and you sell them glasses, you give them glasses, right? But I think I can speak for most optometrists, and I mean some are happy with just refracting, but I think early on, I knew that I wanted more from my degree, right?
Yeah.
That
Do you think some of that came
so
from your experience, from particularly from what you've
yeah,
seen as a
yeah,
kid?
yes,
Do you think that
yes,
was a bit of a driving
yeah,
factor behind? Well, actually,
yes.
nothing wrong with refracting.
No,
People need
not at all. Yeah,
glasses, but
yeah.
I want to do something with a bit more
Yeah.
grit to it.
Yes,
You know.
100%. I would say that is probably one of the driving forces that led me to pursue a more clinical environment. All right, knowing again what I know about my eyes and my own personal research and directed study, and knowing what optometry has to offer. I said, hey, I'm not living to my full, and it sounds so corny, right? It sounds so corny, but it felt like I'm not living to my full potential, right? It sounds so corny to say it out loud, but that's what it felt like. That's what it felt like. And so I ended up finding a clinic, a position opened up that allowed me to get a lot more clinical in my day to day.
And is that when we met? Is that when you were kind of early in your scleral lens journey,
Yeah,
or
that's
had you been
exactly.
doing it for a while then?
No, so before that, I I touched sclerals in the university clinics. I left it in my pre-reg and hadn't touched them since. Right, and so in this new clinic, in this new position, it's a dry eye heavy clinic. Ocular surface disease heavy, and so I was doing a lot of. I started out doing a lot of plugs, syringe and debridement, um, IPL, those sorts of things, right? Very, very dry eye heavy and ocular surface disease heavy. But with that comes scleral lenses, right? It's going to be a time where, IPL can only do so much, drops can only do so much. And that last ditch effort as a scleral lens to help with this person's dry. And so that's kind of how I got into it. All right. A lot of patients were and are referred to this clinic because of the word on the street. Okay, you got dry eyes. This is the place to be, right? And patients will Google. Patients will research. How can I help my dry eyes? I've done this. I've done that. Nothing else has worked. What else can I do for my dry eyes? Right? And scleral lenses pop up. Right? And so I got initially I had quite a few patients who had LASIK years ago, and they would just laugh with not so nice corneas, dry eyes, and they just got to the end of the rope, essentially. I'm here. I need help. Nothing else has worked. So I said, okay, well, let's stick a lens on it, right? Let's stick a lens on it and see where it goes. And so I said, I knew it was something that I wanted to pursue. And my employer at the time was very motivating and encouraging in that sense to say, okay, well, this is something that we're going to do. Let's go on a course. Let's see how we can provide you with the opportunity to grow and to learn and to nurture this clinical skill. And so that's where I ended up running into you guys.
Nice. It's nice when you can work with people who are willing to encourage you and they want you to develop professionally. And because I've said this before, university is just the beginning. That just
100%.
gives you that's just the starting point. And then it's really up to you to kind of keep learning and keep developing. Otherwise it does get bored. Well, I don't know. For me, I got bored doing the same thing. So I had to keep developing. So, but that's really interesting. And I know you are still developing because, before I started recording, we had the conversation about how you've just come back from your IP placement. So is that now your next goal is to get IP and therapeutics?
Yes. Yeah, correct. I think that was always from the start one of the end goals. And I know even with the IP, it's still going to be more. It doesn't finish there, but that was one of the targets that I wanted to hit. Like I said, I always wanted the ability to practice in Bermuda, but at the same time be on par with the US clinicians, with the doctors, right? With the optometrists coming from the States and coming from Canada, right? And in Bermuda, like how we said earlier, I can go very much with what I have at the moment, but I wouldn't be able to prescribe, right? I wouldn't be able to practice in a capacity that says, okay, well, yes, you're on par with everyone else, right? You're on par with everyone else.
But having IP then brings you up pretty much to on par with the US who have IP. So then you're practicing at the same level.
Correct.
And then all you're working on is experience. But everyone has to get that, whether you come out of the US or whether you come out of the UK. Experience is personal.
Exactly.
That's fantastic. How long have you got left of your IP journey?
Yeah, so finishing up my placement as we speak, and then Lord willing, in July, I'll be sitting the college exam, and then fingers crossed all goes well with that. But I feel confident, right? I feel ready. I feel ready for it.
I mean, I'm a big advocate for IP. I think optometrists should be leaving university with IP. I did my US stint, and I know it's possible. And in terms of what it allows you to do in day-to-day practice, and I'm not talking about, you see some of these guys, some friends of mine managing all sorts, and you're like, wow, right? You're like, damn. But you don't even need to be doing that. Even if you can help your hay fever patients, your dry eye patients, right? Your contact lens patients who are just allergic, the ability to fix that without having to ship them off to tertiary care or ask their GP to do something is really satisfying professionally. So you'll love it. You'll smash it, and then you'll just be like, wow, why isn't
and like you said, not everyone is working in an eye casualty setting. Not everyone is putting an eyeball back in the eye, right? But you do have those individuals who know you, who are comfortable with you, and who are comfortable with your practice, and would prefer to see you. Even if it is just for the slightest thing, they would prefer to come to see you rather than being referred off to someone else, right? And so that's another reason as to why I want to be able to prescribe. You know, the patients have confidence in me to fix whatever problem they've come with. But I want to be able to fix that problem, right? I don't want to be able to say, oh yes, thank you, but you know, I'm gonna have to send you off for this one. I want to be able to fix that problem, right? I want to be able to care for my patients, right? That I think should be the goal for any optometrist, for every optometrist, right? And I think seeing and experiencing, you know, in Bermuda, having worked in Bermuda for a bit, and seeing the US model versus the UK model. And again, I'm not an expert on NHS, right? But I think with regards to optometry, it's very much identify and refer. Identify and refer. That's one of the vibes, and you know, one of the things that I saw coming in from the outside, if that makes sense, right? That's what I saw.
Yeah.
And perhaps inherently someone, you know, growing up as a kid in the UK, going to, you know, the local high street optometrist, you know, whatever multiple, you insert the name, right? That's what they're used to. But I wasn't quite used to that, right? So I was honestly, I was a bit confused as to why simple conditions are just being sent to the hospital when they didn't need to be, you know, or being referred to, you know, secondary eye care when they didn't need to be. I was puzzled by that.
It's very different for anyone who's done the North American model. The UK model is very different, and you know, but the UK model for many years was still a lot more advanced than some of the other
100%. Yeah.
models
Yeah.
that are out there.
Yeah.
It's just, I mean, like North America, Australia, New Zealand have such strong optometry now, where they're doing more management,
Yeah. Yeah.
optometric management.
Yeah.
And so I think they expect it. I think the UK public doesn't quite get it yet. I think
Yeah.
they are still, the majority of the UK public think we are refractionists or contact lens
Yes.
fitters,
Yeah.
and we
Yeah.
don't really do the health side of stuff.
Yeah. Yeah.
But that slowly, I think, is changing. That
Yeah.
message is changing.
Of
You know, I
course.
had
Yeah.
a patient yesterday, a care home patient who the care home had called, said he'd got red eye. Paramedic had rocked
Yeah.
up
Yeah. Yeah.
and prescribed chloramphenicol. The child of the patient was not
Yeah.
happy because they had a
Yeah.
family member who was an optometrist.
Yeah.
Brought them
Yeah.
into me, and you know, this eye was red hot,
Yeah.
corneal edema,
Yeah.
right? No light
Yeah.
perception only.
Yeah. Yeah.
I strongly suspect they were herpetic
Yeah.
uveitis,
Yeah.
keratoconjunctivitis.
Yeah. Yeah.
So, you know, I was like, you know, someone's try to put chloramphenicol on
Yeah.
this.
Yeah.
And
Yeah.
so the general public really should know that if you have an eye problem,
Yeah.
go
Go
to
to
eye
the
people.
optometrist. Yeah.
Yeah.
Exactly.
Yeah.
That's the thing. The amount of people that I get coming in, you know, especially when I was working in the multiple, saying, oh, you know, and I still do get it, you know, in my current setting, but the amount of people, oh, I went to the GP because my eye was a bit funny and they gave me chloramphenicol and it's a week later and it's gotten worse. Can you take a look at it? Right? And sometimes I almost feel like saying, well, if you would have come to me a week ago, you wouldn't have been in this position. Yeah. You know? But like you said, that's just public perception, not fully understanding what optometrists do.
Yeah. What we can now offer. And it has
Yeah.
progressed. I mean, there was a time where all we could do was refract, you know,
Yeah.
but now,
Yeah.
you know, full
Yeah.
IP, you can pretty much treat anything.
Yeah.
Ocular related, depending on
Yeah.
how comfortable you
Yeah.
are. This
Exactly.
hepatic keratouveitis, conjunctivitis,
Mhm.
literally, I looked at it and went, this guy's like 695 in one eye, light perception in the other, AMD, looks like his nerves are shot. I went, I think this is one for the eye. I think this is one for the eye department. And so I did. So, so I was like, I'm at my limit here in terms of what I feel comfortable doing. So
100%.
Ship it off to a consultant who does more of it than I do. And it's nice. It's nice to have that. And I think the UK is quite good at that in terms of having the appropriate referral. But
100%.
Then it's a bit postcode lottery as well. Unfortunately, you kind of depends where you end up. I mean, dude, that was it. Like, we're at 40 minutes. I told you, like 30 minutes just flies. So that's fascinating. For me, the reason I wanted you on was because it is such an interesting journey about how you grew up in Bermuda and have ended up in the UK. And the fact that, UK optometrists can practice in a couple of the Caribbean islands, because every once in a while you see it pop up in the optician magazine, would you like to go to A, B, C, and D for X number of months to work? And I never quite understood it. But now I get it. It's like, well, like you said, small population, you've got to import some of your specialities. And some of these X dependencies, I guess, is what it would come under. Acknowledge the UK registration, so you can go and practice like you practice here, but with sunshine and and beaches.
That's exactly it. I mean, if anyone listening is interested in okay, what's it like practicing in Bermuda, right? Find us, shoot me an email or a message or something. I don't know if I can get my information there or they come through you and you just send them to me. But if anyone is interested,
I'll tag you in. I'll tag you in the post, Trae. And then also if anyone reaches out to me, I'll put them in touch with you. Probably via your social media that way. But that's really kind of you. That's really nice of you.
Opportunity there for sure.
Yeah, that's great. So do you ever think you'll end up back in Bermuda kind of full time, or?
I think Bermuda's always home. Bermuda will always be home. I'll never say never, right? Put it that way. I'll never say never, right? It's still a few more things that I want to get under my belt. With IP being one of them, even though that's soon to be under my belt. But it's still just a few more things that I want to be able to take back to the island, because the island is small. All right. Because we don't have access to universities and continuing education and different things like that. If you are on the island, it can sometimes be a bit difficult, to keep up with the clinical skills and the what's new and the who's new and this, that, and the other in optometry. Luckily, we're not too far from the East Coast, about an hour and a half. So Vision Expo, they're in the States. I know quite a few of the optometrists that regularly take that trip. But apart from that, I think on the island, it can be difficult to, just say, oh, this weekend I'm going to go to a scleral lens, workshop or something of that nature, right? So it's a few more days that I want to get under my belt before running back home.
I mean, that's amazing. So I'm gonna edit it there, because I know you've just come home from work. You've not even had dinner, and it's 40 minutes. And I really appreciate you taking the time, Trae. I have one last question for you,
Yes, sir.
which will be good from your perspective. If you had to give anyone, let's say a new professional, one piece of advice, right? Professional advice. What would you say to them?
Oh, that's an excellent question. I think if I had to give one piece of advice to newly qualified or someone in optometry school or what have you, I think it would be to not limit yourself to your testing room. All right. And I say that to say that, again, you may be in a position like how I was initially, was, okay, this is where I am. My employer says this is how things are run. This is what we offer. Okay, that doesn't mean that that's all you have to know. That's all you have to, work with. All right. I started my prof cert in glaucoma whilst I was in that multiple, when there wasn't perhaps a need for it. Right. We weren't seeing glaucoma follow-ups. We weren't in a glaucoma referral refinement scheme. But I said, no, this is something that's going to help me, whether it be now in my everyday, when I'm faced with a suspicious patient, with a suspicious, disc or field or what have you. I have just that extra bit of confidence, right? I don't know where I'm going to be a year from now. Maybe that Prof. Glock is going to help me perhaps get a position, right? That's going to help me to grow and to elevate. So I say that to say, again, don't limit yourself to your testing room, okay? And network. I think it's far more useful than what we oftentimes think. All right, network. That's what I would
Amazing.
recommend.
Thank you ever so much, mate. I really appreciate you taking the time and being so open and honest about everything, which is really, really cool. So with that, I'm just gonna say thank you, Trey. I want to thank the audience for taking the time. Again, please do like, follow, and share. If you have any questions, stick them in the comment section. And if you need to get in touch with Trey, I can facilitate that for you. So thank you very much, everyone. Take care.
Yes. Good night.